So thanks so much for joining again. Um, we're so excited to have Senator Alston here to talk with us today about her experiences with lung cancer and advocacy. She's currently a state senator in Arizona's 24th district, and she's done so much in the way of public education and advocacy to make healthcare more accessible to all. So we're really excited to have Senator Alston here. Before we start, I'll give a little introduction of myself. My name is Raya Suleiman. I am a representative at the American Lung Cancer Screening Initiative, and we're a nonprofit based across the country with the goal of raising awareness for lung cancer screening and early detection, making sure that everyone has access to lung cancer screening centers to make sure that their fight against lung cancer results in a positive outcome. So that's a little bit about us. And I think the first question, I'll hand it over to Senator Alston, just to tell us a little bit about herself, you know, who she is as a state senator and how her life was personally affected by lung cancer.
Okay, are we ready?
Yes.
Okay. My name is Lela Alston. I represent Legislative District 24 here in Arizona, which is Central Phoenix and South Scottsdale, for those of you who are from elsewhere. I'm in my 29th year of service in the legislature, but I did 18 years, many years ago in the 70s, 80s, and 90s. Then I ran for a statewide office, lost handily, and went back teaching school full time. So I'm a school teacher by profession and taught in Arizona schools for 35 years. Most of those years with the Phoenix Union High School District. In fact, all but one of those 35 years was with the Phoenix Union High School District. And now I currently serve on their board. So I went into politics because of public education, and I stay in it for the same reasons. But I believe it was 6 years ago, 7 now, I guess, that I was first diagnosed with lung cancer. And for many years, I've been a patient at the family practice that is associated with a major hospital here in Arizona, and that is Dignity Health. So I've been their patient for a long time. And one of the things they do very well is to train interns. And so I got a new intern for my new doctor, and I asked her for a chest x-ray. And she said to me, I think we've got a program over at the hospital because CAT scans find cancer, lung cancer, much sooner or earlier than do chest x-rays. And so she looked into that for me and got me into the program. And for several years, I went in once a year and everything was just fine. I didn't have any cancer. But then one year I did, and that was 7 years ago, approximately now. And I can only say that my situation was handled so well, and I don't know how other people experience this, but being with that practice through Dignity Health was just a godsend. The day that I was diagnosed, or that I found out that I had cancer, lung cancer, my surgeon had one of his staff people stay with me while they actually physically walked me to an appointment with an oncologist that same day. And their theme is hello, human kindness. And I will tell you that that is exactly what you get when you go to that hospital. I know that other hospitals handled this very, very well. In fact, my surgeon now has left Dignity and gone on to another of their major competitors. But I think that how you feel about the diagnosis is directly related to how you receive the news and how you're cared for and watched after by those people who are giving you the news that none of us really want to hear. I was also very lucky. It was the start of a legislative session. I had not told my leadership that I had been diagnosed until right before the session started. And so I missed a major part of that session, but was able to go back before the session was over. And I was very lucky that in our Democratic caucus, we had two medical doctors who also knew, the person who was handling my case. So, and I, of course, gave permission for them to receive any of my medical news. So it was like having extra doctors on my side. So in that respect, and in many others, I am very, very lucky. So it was scary. It's something nobody wants to hear, but when you feel good about the people who are taking care of you, then you feel good about what your outcomes are going to be. And definitely, I have had wonderful outcomes. So I had the original surgery. I had radiation with a piece of equipment called a cyber knife, which delivers very pinpointed radiation. And I had a little chemotherapy after that. Well, then 2 years ago, with my routine follow-up, they found that I have cancer again. So this time I was already receiving, well, they started me on a new, regimen of chemo. And that was unlike what I had done before. So it was a very different treatment experience. But again, having that team that is, that I believe in so much was, again, an absolutely wonderful thing. So now, 2 years later, I just got, like month before last, the good news that I'm cancer-free. I'm still doing my chemo, but from where I started 2 years ago to what I'm doing today is just like a piece of cake, because little by little they took, I think I had like 4 medications that I was getting when we started. And now I'm down to just one, which is an immunotherapy, chemotherapy. And I'll probably be doing that for a while, but the effects of the procedures are, like, I don't even know, that I've had any side effects. I mean, it takes a hunk out of my day to go in and get that. But other than that, I feel good after. I can go out and do whatever I need to do as far as my daily life is concerned. So I'm very, very fortunate in that regard. So I think I covered a couple of those questions. What else would you like to ask?
It was wonderful. And just to reiterate, we send our heartfelt congratulations for that cancer-free diagnosis. We're really happy to hear that, and we're also really happy to hear that you had such positive experiences with that multidisciplinary team of doctors that you mentioned. And just to touch on something you said earlier on, we want to reiterate that CT scans have been shown to reduce mortality to a higher extent than those chest x-rays. So for anyone watching out there, if you do meet the guidelines for screening in the United States, it is recommended that you get a low-dose CT and not a chest x-ray. like Senator Alston and her doctor discussed. And before we move on to the next question, I also wanted to remind people in the audience just of the screening guidelines that we have in place currently from the USPSTF. Excuse me. So I'll just read those out really quickly. It's just for adults aged 50 to 80 who have a 20-pack-year smoking history and currently or smoke or have quit within the past 15 years. So those are the new guidelines. They've just been updated, just to keep in mind. But thank you, Senator Alston, for sharing that experience with us. So I think the next question would be, I think you already covered a lot of it, but how you found out about your lung cancer diagnosis, which you spoke of. And can you just talk a little bit more about the experience of getting screened? Was it a stressful process? Was it painful at all? Just, what it was like.
No, the screening was with a CT scan, and it's totally, painless. So the screening part is no problem at all. One thing that I guess I worry about is, I've had several people tell me that they've got lung cancer, but they were never a smoker. And I was a smoker. So, I knew that I should be watching out for myself. And I would encourage any former smokers to do that as well, to talk to your doctor and say, hey, listen, do I qualify for this CAT scan protocol? And because once I qualified, then I no longer had the responsibility of paying for the CAT scan. Once I qualified, and I don't know if that's universal or if that was just with the hospital that I am affiliated with, but that was a wonderful thing because those CAT scans can add up. And even going through the hospital's protocol, I know I got a super bargain on the first one. It's like rehoming a pet. You want to make sure you've got some skin in the game, so to speak. And I think that that's what happened with my experience, but I don't know what if that's a universal experience. But I did say that, I've heard from several people who were not smokers who accidentally found out they had lung cancer. And I don't know how we get to them. There was one of our DPS officers at the Senate who was in a car wreck. And when they checked him out from the car wreck, they found out that he had lung cancer. Another friend of mine I just spoke to a few days ago said, she had just like a bruise on her chest. And she thought it was from an industrial accident that she'd had. And so she went and got that checked, and she had cancer when it came back. And that was really pretty devastating for her because she was caught totally off guard. So, I guess I would encourage people to be aware of their health. One of the things that I've done to help spread that word, because I feel like I've been so lucky that those friends of mine who I'm most comfortable with and know their smoking history, I just out and out nag them to go to their doctor and talk about whether or not, they should be considered for this program. And I've had several people go to see their doctors, and fortunately, so far, none of them have had cancer. But one of the things I think that is in a smoker's psyche is that you always have that at the back of your mind that you could get lung cancer. You're never ever free from that. So one of the gifts of going and finding out about it is to find out you don't have it. And so, I had that peace of mind of, that I was getting regular checkups. I knew I didn't have lung cancer. So for those years until it caught up with me, that was a very positive thing in my life. So I would encourage anyone who's been a smoker and quit fewer than 15 years ago to please, check around in your neighborhood or your community and see who's got these programs available, because lung cancer does kill people, but when you find it early, you might be a little inconvenienced, but you're certainly going to be much better off than you would have otherwise. So I've joined forces with the American Lung Association to do the lung force walks each year. So I lean on a lot of people to come out and walk with me. It's of course not been so great with the COVID isolation, but I think that we'll all kind of rally together and pick up in doing those kinds of activities that we haven't done in the past. But I also try to make it a point to talk about it on the floor of the Senate or the floor of the House when I have that opportunity to talk about, how lucky I am and how other people need to be aware of these opportunities to feel better about themselves and know that they don't have cancer, or catch it early so that they can beat it. And it's very curable if it's found early. And every day there's new and different protocols that work for people that have had things not work for them in the past. So anyway, that's kind of what I've been doing. And then do we have other questions?
Yes. So thank you so much for your insights. I just want to touch on a few things that you talked about for that last question. So you mentioned that your screening was affordable for you personally. And I just want to remind everyone watching that screening based on the state you're in is often covered by Medicaid or Medicare. So always just check your local state, policies. You also mentioned that it's really important to talk to your doctor especially about your smoking history if you are a current or former smoker, because that is something that the guidelines focuses on. So I'm really happy to hear that you were able to discuss that with your doctor, and you encouraged your friends who may be smokers to also discuss that with their doctors. It's really important. And then lastly, you mentioned multiple times that catching the cancer early is really integral to having a good outcome. And I just wanted to emphasize that yes, catching lung cancer specifically at earlier stages, really often results in better outcomes than if you catch it at later stages. So thanks for touching on that. And I think my last question, because you did talk about your wonderful work with the walk, which is really great to hear. I think my last question for you would be what you would like to say to anyone who's currently struggling with lung cancer or the lung cancer diagnosis process, just because you've been through it. And I think you have a lot of insight and experience.
Yeah, I guess my advice would be that if you're not 100% happy and confident with the team that you've got, that you're working with, to seek other alternatives. I found being in the Dignity Health system, and then, between my first diagnosis and my surgery and my second, Dignity Health has opened a cancer center. They've always had one, but they've now got the physical building there where I go in. On my first round was at the hospital itself, but I wouldn't be afraid to seek out a different team if you're not happy with the kind of service or support maybe that you're getting, because I found that the support that I got from my medical team for me was every bit as important as the skill of the surgeon. And you know, this friend of mine that I just talked to earlier this week, she said, oh, well, you know, I got this x-ray and they came back and said it was cancer. And so then I found an oncologist, and then I found of this. You shouldn't have to do that. It should all be in one place, because now she's worried that she's going to have a relapse where, you know, I've had a relapse, and I know that even if I have another relapse, I'm going to be in good hands, and we're going to find it early. And we're not going to have to wait for some strange circumstance to point it out. So I would say the regular follow-up, don't skip appointments, do exactly what, you know, you're asked to do, but you should always feel comfortable with your team and know that they're working for you and with you. And, you know, my situation has been so positive. And I really want that for everyone else that's faced with this situation, because it is curable, particularly when we have the early detection. And unfortunately, the early detection is not as obvious in our medical circles today as I wish it were. I wish that it was like a routine screening, just like you get your mammogram every year, and you know, you do this, you do that, you get your annual physical. Well, for people who smoke, I think they should have an annual CT scan. But as one of my doctors pointed out, you know, lung cancer is not a disease or condition that people feel sympathetic about. You know, then often those of us who have it blame ourselves, you know, for the choices we made when we were younger. But, you know, please set that aside and get the good medical treatment that is available and that you deserve, because you deserve not to be worried. You know, you deserve to have the worries lifted as much as they can be. Now, you know, it's never going to be lifted entirely because it is a serious disease and you can die. But you also need to have all those systems working for you, because I happen to believe that my mental well-being directly affects my physical well-being. And so that's my belief. And that's why I think it's really important to be able to do your normal life as much as you can. And
yeah, and we really appreciate those insights. And I especially agree that, you know, lung cancer as a disease needs to be destigmatized, because everyone deserves care at the highest level. And we're so happy to hear that you've had such positive experiences with your team. And we hope that everyone who's out there currently struggling with the same has that close-knit functional team. And before we close, is there anything you, Senator Alston, wanted to add for those of us watching the recording?
well, for those, I think we've got a people from a lot of walks of life watching, not just patients, but caregivers at all the different levels as well. And I just want to say thank you to all of the medical professionals that are working in this field and who do it so well. And to those organizations like yours that does try to to get people into early detection or not, you know, whether you have it or not, because the gift is there, whether you have lung cancer or you don't have lung cancer. But, you know, I would just say, you know, please don't be afraid, because when you're doing the right things, it's totally a disease that can be conquered. And I truly believe that. So I guess that's my best advice.
Thank you so
And
much. Thank you. We really, really appreciate your time and talking about lung cancer prevention and lung cancer screening and your experiences. And just before we stop the recording, I'm just going to share the American Lung Cancer Screening Initiative's contact information in case anyone watching.
wonderful.
Yeah, and in case anyone watching at a later date has any questions, you know, questions about Senator Alston's experience or questions for us about the screening process, please do not hesitate to reach out. We're always looking for ways to make the screening process more streamlined. And if you're out there and you want to help with this initiative, also reach out. We're always looking for all hands on deck. So thank you so much, Senator Alston. And we really appreciate you taking the time to do this today.
Okay, the pleasure was mine.
And I'll just stop the recording.